Hello, everyone. I am Kathy Merrill. I am the CEO of Washingtonian, and I am delighted to host this talk on mental well-being. We have three terrific people to hear from today. I'm going to introduce them and then pass off the moderating role. Our first guest, Dr. Stephen Jones. He is the president and CEO of Inova. It is, I hope everyone is familiar with it, is the leading healthcare system in our region. They have 5 locations. He oversees 18,000 people. And more important than that, Inova helps 2 million patients a year annually. That is a lot of patients. He is a native of Arkansas. He grew up on a farm. And yes, he can drive a tractor and bale hay. You might not look it today in his suit and tie, but he can. He went to University of Arkansas. He did his residency in Vanderbilt. Prior to coming to us, he was president of the Cleveland Clinic Hospitals, where he oversaw 11 hospitals. He is the first head of Inova, who is also a doctor. He is a cancer surgeon. His focus is on urological oncology. And so he's the first medical doctor to oversee this hospital. In his spare time, I know you do things for fun, but he's also written over 150 articles and 2 books. So he both comes as someone overseeing a healthcare system and as a doctor. One of the reasons I want to add that we wanted him on this is because Inova Behavioral Health Services really is part of the Inova system, and it supports total wellness and everything from inpatient substance and detoxification to just ongoing counseling. That is a big part of the Inova system. So welcome, Dr. Jones. Dr. Marissa Leslie, she is the chief of psychiatry for Adventist Healthcare. She has over 15 years experience in leadership and in clinical experience. She specializes in treating depression and PTSD in children and adolescents. So for the parents that are out there, she is a true expert there. She's also a professor of psychiatry at Georgetown University. She holds a bachelor's degree from Oakwood University and a medical degree from Loma Linda. That's a sort of a renowned medical school in Los Angeles. If you're unaware of it, she did her fellowship at Children's Hospital in Philadelphia at University of Pennsylvania. One of the many reasons we wanted you here is an expert, but also I know that you personally have been a really strong advocate for the destigmatization of mental health and how mental and physical health work together for wellness. So I hope you'll talk about that. Monica Schmood is going to moderate this segment. She is the market president for Cigna Healthcare in our region. She oversees 1,200 Cigna employees and 1.4 million customers. Washingtonian is a proud customer of Cigna. Monica has been in healthcare for 3 decades. She got her degree from University of Wisconsin at Oshkosh. She serves on a lot of boards. I can't name them all. Northern Virginia Chamber of Commerce. She's on the Dean's Council at University of Maryland of Public Health. She was named 2019 Most Powerful Woman in Washington by Washingtonian magazine. She's also the recipient of last year of the March of Dimes Hero Award. Monica, thank you for moderating this important session. I know you're an expert in this, and the timing, actually, I want to say, is especially good. Cigna, there recently, I think in between when we planned this and we did it, announced, the Cigna Foundation announced they were giving $5 million in grants that people could apply to go towards children's mental health. So, I'm glad to be associated with a company who is doing good. I'm going to log off and hand it over to you, Monica. Thank you.
Great. And I am too, Kathy. Thanks so much for the kind introduction. We have a lot of ground to cover here. Good afternoon, everyone. On behalf of Cigna, it's a pleasure to be here with you today. It's such an important topic for us to discuss today, and timely and relevant, as I mentioned. The reality is, just a few months ago, that we as a community, we were already suffering, and we were facing some significant challenges that were impacting the health of our community. And this was before the global pandemic hit. So with COVID-19 and all the changes that we're experiencing in the last several months, the spotlight has really shifted dramatically to our own mental health. So the impacts of depression and anxiety and the growing effects of loneliness overall to our health have now potentially even much more become real to all of us. It's a significant problem. Add in the additional weight and the impacts of systemic racism and social unrest, and it brings us to the real need to understand and learn how to manage our own mental health. It's more important now than ever. I think we'd all agree. Kathy, as you mentioned, I'm joined by leaders of two prominent healthcare systems in our region, and I'm looking forward to a really meaningful discussion. We have some important takeaways for this audience and some tips to talk through. Just to note, listening in, we have a variety of key stakeholders. Kathy mentioned that as well. They represent employers in our region, both large and small employers, private, public, government, and education. We also have representation today with the region's workforce. We have frontline workers joining us. Those that have also transitioned to virtual home environments like I have. Those that have lost jobs and are seeking employment now are joining us. We have educators and families that are facing the challenging reality of what return to school might look like. We're dealing with that today. We also have community leaders and members of government agencies joining us. So we've got a great audience to talk with today. So excited to join this panel discussion and lead us through some of these important topics. So let's get going. We've got a lot to cover. Dr. Jones, I'm going to come to you first. So Kathy mentioned a little bit about Inova and you specifically. Just to remind everyone, as a leading provider of healthcare in Northern Virginia, you have 5 hospitals, right? 18,000 team members who serve more than, Kathy mentioned, 2 million individuals on an average year. That's astounding. But this year has been really, let's face it, anything but average, Dr. Jones. So we're 4 months into the pandemic. Let's just start off the discussion of you telling us really what are you seeing on the ground right now?
It's amazing that it's only been 4 months, Monica, and you're right. It's a year none of us could have ever envisioned in so many different ways, all at least starting out of this COVID epidemic. We were a moderate hotspot. We certainly were never in the situation that New York was in back in April and May, but it got pretty intense here. We at one point had over 400 COVID-19 patients in the hospital when we got to our maximum. We're now down under 100, which we're grateful for, both that the patients are healthy and frankly that our teams are not as stressed as they were in taking care of these intensely ill patients as we were at one point. We're seeing things tick up across the country, as I'm sure everyone is aware, and we do have some concern about that. I'm a little obsessive about watching the numbers, both our hospitalized patients, but even the number diagnosed in the community. But right now, things are under good control. I think that the main thing is that we have clearly learned how to take care of COVID-19, a disease that didn't exist 5 or 6 months ago. The amount of things we've learned has been immense, and that I'm especially proud, for example, that only yesterday we got our mortality numbers in, because this is a serious disease. Patients do die from this disease despite some of the potential underestimation of it. We in healthcare talk in terms of observed to expected mortality. You know that some number of people from any condition are likely to die from that. And our numbers came back yesterday at literally 50%. So in other words, only half as many people died of COVID-19 as would have been predicted by their illness factor. So clearly we've gotten very good at taking care of the disease. One of the things is we've gotten, for example, there's a technology called ECMO, which the long abbreviation, but basically a special form of life support that early in the pandemic, our colleagues in the other hotspots told us don't even put patients on it because frankly, they will all die. And our team was convinced that we should give it a shot. And indeed, over 70% of those most critically ill, the ones that frankly were being given up on in some geographies, over 70% of those patients have gotten home healthy back to their families during this period of time. So, quality and safety has always been the most important thing to Inova well before I got here, and certainly during my tenure. But there's a reason that we've been recognized as the only system in the country that has every hospital 5 stars, and the teams have proven it. So on the ground, we got a lot of confidence in our ability to care for this disease.
Wow, just amazing. I want to just pat every one of those on the back, shake their hand, give them a high five, all of it. Socially distant, okay? I'll do that safely, right? Wow. Let's stay on that topic just for a moment about those frontline workers. I'm thinking about the physicians, the nurses, the healthcare providers, and what a mental health toll this pandemic has most likely had on them. I mean, I just think about your vast experience as Kathy described. Have you seen anything like this before, and how are they dealing with it?
Someone mentioned that the word unprecedented was being overused. I can't find a better word. I mean, literally, this has never existed on this planet, combining the way I describe it as 4 crises. Obviously the COVID crisis followed quickly by a financial crisis that we've never seen before, but very quickly we've gotten into 2 more crises, and you think of how do human beings handle 1, let alone 4. So the crisis of racial injustice, which is obviously not new and we're not going to end immediately, but that crisis, of course, now becomes weighs on every single person within the organization. And finally, it brings us to the one, again, not new at all, but the one that we're here focusing on today, which is the mental health crisis. And that this is exhausting work for our team members. I sometimes tease the one thing about doctors and nurses is they're human beings. And that in this setting, they're being taxed by working harder. Taking care of COVID patients is physically more difficult than taking care of quote, normal patients, just donning all the protective equipment that people have to be in. And then the compassion fatigue that we see is clearly a mental stretch for multiple members of our team. For example, we have people have had to learn to do things they hadn't done previously. So we, for example, have had pediatric nurses who normally on an inpatient basis, their patients usually get better, thank goodness. Many of those, because we have far fewer pediatric patients in the hospital these days, they've voluntarily gone to help take care of COVID-19 patients. And unfortunately, some of those patients are ill for a long time. We get attached to them, and some of those patients ultimately don't go home to their families. And so it's been, incredibly taxing on them in addition to concerning for their families. So, I think we'll come back to it a little bit, but, we've done a lot of things to try to help them with their own mental well-being, because they all of us in healthcare think that we're superheroes. And again, at the end of the day, we're only people.
That's such a good point. Gosh, they're such heroes. You mentioned patients and also the care that you're delivering to patients. How have your healthcare workers been approaching the specific mental health needs of the patients that they're seeing?
Well, and Monica, we've spoken several months ago now about telehealth and how much you're a big believer and a national leader in the thinking on distance health. That's been a key thing because, the patients have been afraid to come in physically. But what we've seen is not that it's been as good, but in many ways, as I think you saw before many people, in some ways it's better that people in their own setting where they've got their own comfort, they're not in an unfamiliar setting, can see a professional. And obviously Dr. Leslie knows way more about that than I do. But we've seen that as one of the key things that we've been able to deliver. We now are seeing patients in person again, fortunately, and some of that fear is now going. We've coordinated with services across Northern Virginia to, provide not only the direct patient care, but all the other behavioral health care that, again, Dr. Leslie is certainly the expert on.
Yeah, absolutely. I want to spike that out for our listeners. So you're right, I'm a big fan of virtual care. A statistic we've seen at Cigna since the pandemic came upon us in the last 4 months, we saw virtual health visits through behavioral health spike by 50%. And the latest statistic I've seen through June is that it's up 60%. So I love that patients are finding their way to virtual care for behavioral health. And Dr. Leslie, you'll speak on that as well. And then the other kind of resource and tip that I'll offer is for those listeners to think about their EAP within their benefits plan, There are, free visits there as well as an entry into the system. And Cigna saw a massive uptick of individuals reaching out for help. And so as a result, we doubled the amount of free visits through the EAP. So just urging callers to think about their benefits plan and potentially their EAP benefit. Dr. Leslie, you ready? I'm going to come to you next with a couple of questions. So I want to hear really from you as a psychiatrist, the head of psychiatry at Adventist. What have your patients been, seeing and sharing with you over the last few months?
I see a combination of youth and adults. And initially, I was really surprised by just how resilient some of my patients were, because they're coming to get additional assistance with their mental health, but they really just responded to the crisis, bounced into online learning. Their anxiety seemed to decrease for some of them. But then slowly I'm starting to see, more concern around the things they're not able to do. They're not able to attend graduation personally, and that's a huge loss. It's something they've envisioned their whole life, and they've had to adjust to a different reality. I'm also seeing, though, that, like you said, that many of them are engaging in their healthcare, and our show rates have increased in certain areas, especially in some of our more vulnerable populations, where we work with parents and caregivers and children. But I have been encouraged by the increased engagement in healthcare via telehealth, which I am a strong proponent of as well, Monica. But right now I'm seeing a lot of grief, weddings that aren't occurring. And for those who have lost loved ones, they haven't been able to gather to memorialize that life. At the same time, I'm also seeing some resilience and adjustment to the new normal, as we call it.
I don't know that, right? The new normal, we'll have to put that out there and figure out what that looks like. You mentioned the missing things, right? Missing big events, and what a toll that, just really having on our community, on our overall mental health, because as you mentioned, it's groups of people coming together, and that no longer exists, right, due to safety. So I think about Adventist, and I think about all of the tremendous care and support that you offer your patients, but specifically the community, and specifically Maryland. Is there anything that you could inform us on what Adventist is doing and what you're seeing in support of the community as a whole?
Right. Well, Adventist Healthcare, it's our mission to really be involved in the community and look at all aspects of healing. We have certainly continued to partner with partners that we've had before. So food banks, we know that there has been an uptick in visits to food banks with the financial insecurity that Dr. Jones mentioned. We continue to partner with our infants and toddlers programs. I mean, we connect with those vulnerable populations. We are offering telehealth to the community for primary care, for mental health care, and we are certainly seeing new patients and accepting new patients. And the other thing that I'm really proud of that we've been doing is the civic engagement around the discussion of social justice and inequity. It's really important because our employees are not just employees, but they're members of the community. And our employees, as a member of a larger community, this has been weighing on our hearts. So we've allowed moments of solidarity, silence, reflection, engagement, prayer, to show that we are healthcare workers and we're a part of the community too. So I'm very proud of the community work we've been doing.
I love seeing that as you share that through social media, memes, etc. It's uplifting to see all the community involvement engagement that you've been doing. So thank you. Thanks for doing that, and all of those that are supporting at Adventist. I'm going to pivot next to our own personal well-being, if you will, mental health. Think about those that we see more often. Those are those in and around our households, right? So we're spending more time at home, all of us, and we're seeing each other more often, more frequently. And I'm thinking about any tools and tips that we can share specific to what signs should we be looking for within ourselves, and also signs that we're looking for our loved ones, that there might be a mental health challenge going on that we should be aware of.
Right. Well, I'll start by saying, you mentioned that my interest is post-traumatic stress, and I think many people would say this is a prolonged collective trauma. And in trauma and in crisis, we have normal reactions that feel abnormal because they're not us. So we may not sleep well, we may not eat well. I personally experienced that at the start of the pandemic, because I'm sure, as Dr. Jones can attest, and actually many people listening, we didn't think it was possible to be busier than we were, but it was, and we were busier. So many people have probably experienced the sleep deficit and, the decreased appetite and the increased worry and increased irritability. Maybe a more harmonious home where you don't typically argue, you're arguing more and you're tired of each other. These are all normal reactions to an abnormal event. But what tips the scales to when you should seek professional help, because I think I look at mental health as something that should be maintained, right? So in order to maintain good mental health during a crisis like this, things like routine are important. You may not be going into an office, but I strongly encourage get up at the same time, go to bed at a reasonable time, shower, have your meals, don't skip these things. And when you notice that you're not doing these things on a prolonged basis, or you're not able to engage with your family, or you're calling out of work and you're just feeling hopeless, exhausted, and maybe you're having dark thoughts, it's at that point that you engage with a professional. And that professional may be through EAP. It may also be through looking for a provider, through your insurance company. And there are people volunteering time too. But I think when it starts impacting your life in a significant way and you can't function, that's when it's really important to seek help. And help is available. Even though some things may be closed, help is available, especially online.
Yeah, completely agree. I'll say here that lots of resources available. We want to continue to share those among our group and to those that are listening in. I'll say Cigna.com has COVID-19 resources available. We have a hotline support for anyone in the community calling in. It's available 24/7 to help with those needs around COVID and those stressors that that they're experiencing. So I'll put that out there. Let's talk about maybe our most vulnerable today, Dr. Leslie. And before we kind of close out this section of the tips around how to notice it and what to do around noticing some changes in your mental health, if someone does need urgent care, what would you recommend that they do?
I know people are afraid of an emergency room, so I'm not just going to say go to an emergency room, but you still can actually. You really can. If you're at the crisis point where you think you need hospitalization, you can still go to an emergency room. Many emergency departments are taking precautions to keep everyone safe. I should say all, because this is what we do. But in addition, if you have a mental health provider, reach out to them. We are still paying attention. We are answering our phones. We are checking our messages. And some of us may reach out to you proactively, but reach out and schedule that visit and ask for more frequent visits if you really need it. But if you feel like you're on the verge of crisis, please don't delay it. Because I know we've seen that in the physical health realm and in the mental health realm. I just encourage people to seek help early. If you have any questions about this going and tipping into a crisis, just seek help early. I'd also say many counties and local jurisdictions have mobile crisis teams that can come to your home or assess. I know various crisis centers are still open. The National Suicide Helpline is still open. Many helplines are open, but I just encourage people to seek help early.
Yeah, so important. Thank you for stressing that. Okay, let's take our conversation into another group of individuals that are joining us today, and those are the employers within our region. I know that we have several on the phone, and they're seeking advice. How do I help my employees? How do I help the workforce through this time, and all the considerations that need to be made if it's a return to work situation or if it is continuing, virtual work and managing the overall needs of the workforce. Dr. Jones, I'm going to come to you with this question because really you lead a huge organization. So as an employer, how do you make the well-being of your team a priority? What could you share with the listeners today?
There's obviously tremendous work going on with how do people, quote, return to work. And I think we should recognize people who are working at home are working right now. And Dr. Leslie mentioned the keeping your routines. I've tried to model some of that myself by doing some of my work at home. It's not my natural space, but I do that. And I intentionally wall myself off and come out at whatever point and say, honey, I'm home, so it kind of separates the work day and the work week. As far as coming back to work, clearly, if your employees aren't healthy, your organization is not going to be healthy. And many of you will need your employees coming back into the workplace. So I think this is an evolving area we're going to have to pay attention to, that I think we should be mindful that some of our obsessions early on probably aren't valid, like surfaces. We're not all going to die if we touch a surface. We should wash our hands routinely, regardless of COVID. But certainly cooped up in small air spaces and rebreathing air does put all of us at risk. So the more that you as an employer can separate your employees, potentially by changing work schedules to where some people are there at various times. A lot of people are putting up plexiglass to separate. Masks, for sure. I walk through our hallways with a mask on when I'm in one of our public spaces. And this isn't a political issue. This is an issue of, getting us back all working and being healthy. And so I think those are the big things, and paying attention to guidance as it comes forward is going to be important. And then very importantly, if you're ill, then don't be in the workplace, whether you work in healthcare or otherwise. Be at home. By those simple measures, I think we can start getting ourselves back to work and being healthy if we'll simply pull together and do most of those things, Monica.
Yeah, completely agree. We have employers, reaching out, and we're partnering with them at Cigna. And it is exactly what you said. It's questions around what does a safe work environment look like, whether that's virtual or whether that's back into an office setting or whatever the environment is. What does safety look like? And then also encouraging questions around thinking about the anxieties and the challenges that the employees are facing now and the workforce around childcare, elder care, safety and commuting patterns, whatever that might look like. So those are real topics that we should plan to continue to have those discussions in supporting the employers in our community, for sure. All right, I've got one big last question teed up for both of you. And so Dr. Leslie, I'll come to you first with this, but Dr. Jones, get ready, because I'm going to ask you to respond in the same. So let's take a visionary approach. And let's think about the long term. And I know you spend a lot of time in your organizations thinking through this, the long-term mental health effects of this pandemic. How are you addressing it now? And is there anything that you'd give for our callers on advice of really how to stay in front of it or combat those long-term effects?
Yeah, I mean, I think because this is such a prolonged crisis and issue, and we've had to adjust really abruptly to a new situation, initially our adrenaline may kick in and we think, all right, I've got my routine, I know where to order things, I know how many masks to have. And then over time, we have time to grieve, like I mentioned, those things that we've lost. I think there will be a lot of grief. I think that we'll have to learn how to deal with our grief and be resilient and not run from it. I also think that, the social isolation is taking a toll. It is taking a toll. I was mentioning earlier in another conversation how I call her my mother-in-law because we have such a good relationship, but I took my mother-in-law out for a drive because she's in a vulnerable category and she'd just been at home so long by herself and is normally such a social person. So I also think that long-term, to use this example, that we'll start thinking more about people we don't think about as much, the seasoned members of our community and what they contribute and how important they are and how important it is to connect and to bring them new experiences. So I took her to a new area she hadn't been to before in a protected way in an N95. But I think we'll start thinking about connection more. And I know that I've heard people are reaching out to high school friends and different friends on social media, and creating new connections. Personally, I have a book club with some friends from around the country, and we've married the pandemic concern of not socializing with talking about social justice. So I think people will also be creative. It's not all a bad story. It presents an opportunity to look at our priorities, what's important, and also as employers and leaders, we'll think about our workforce, our healthcare workers, and how to maintain their wellness, which is so important because we cannot heal if we're not healed ourselves. So I think these are some of the long-term impacts, some negative that we have to attend to, but some positive also.
I completely agree that, gosh, your comments about the importance of the connection, right? And it's very fulfilling. It's so rewarding when you have those experiences that you, as you said, now through the screen, right, with your friends in the book club across the country, but it is that social connection that really kind of feeds our soul and motivates us. All right, Dr. Jones, same question to you. What can you offer our audience?
I think it's interesting. Probably Kathy picked the three of us because we're realists, but optimistic. And so I appreciate your thoughts there very much, Dr. Leslie. There are some silver linings here, that including as regards our mental health and our perspectives on the world. One is that I think we're seeing a further destigmatization of the fact that we are all prone to our own mental health challenges, whether they be very manageable of getting down or some level of anxiety to obviously much more serious than that, but destigmatizing it, resourcing the care for that. And Monica, I go back to, I know this is you've been very passionate from your industry's perspective on that mental health is health, and that we should care for it as we would in any other area. So I think that's will be a positive to see more move in that direction. And then, my last piece of advice on that is that I think people hopefully will embrace the concept of control what you can. You can't change the fact that we're in a pandemic right now. And you can't change the fact that we have financial challenges. You can address some of the things. So we've seen people now willing to, they can have a meaningful conversation, a meaningful input on racial injustice. And that conversation wasn't happening 3 months ago. So taking those positives out of this, I think, we're going to have our mental health challenges, but we're going to have the positives that come out of it. And I think it's a responsibility for everyone, not the 3 or 4 of us, but for everyone in this conversation who's online right now, and the people who will read let's take the good out of this and make our world a better place.
I wanted to pop back in because we have on the Q&A a lot of questions from the audience. I encourage people to write in for all 3 of you. So I didn't mean to cut you off, Monica, but I thought I would ask a few. I'm going to start with Dr. Leslie because this one sort of hit me in the heart a little bit. One of the questions is, what are some of the signs of anxiety in young children that are unable to articulate their feelings?
That's a really good question. And the inability to articulate feelings is the key. So what we see a lot is anger, actually, and irritability. And depending on your parenting orientation, you may think they're being disrespectful or, what's going on with them. I got to make sure I discipline them so they learn how to express their anger appropriately. But I encourage parents to ask, hey, and be curious. I see you can observe, I see you're stomping your feet, or, you're yelling at mommy. I wonder if you're upset because you can't play with your friends as much, or just be curious and explore with them. Help give them some of the possibilities. It will surprise you that when you express curiosity about your child's feelings, how it actually calms them down. Other signs of anxiety in children include isolation, and especially younger children, they actually may be more clingy. You may notice that they start to act younger than they are because they go back to what's comfortable and And actually, we all do that. We all regress a little bit in crisis and in times of concern and distress. So regression for sure, and irritability, and sometimes just like shutting down and not wanting to do new things, and certainly clinging. They may want to sleep in your bed. They may want to see you more. They may want to check in more. But these are signs in younger children.
Thank you. I think that's a really important question. Another question for both Monica and Stephen, who oversee these organizations, a 30,000-foot question. Do you think that we are reaching a tipping point on acknowledging mental health, the stigma behind it? Are employers starting to accept it more? Do you see, do you see that in either of your organizations, and what you see in Cigna sort of coming through the door? Monica, do you want to go first?
Yeah, I'll go first, Kathy. I sure hope so. I sure hope that we're at a point of acceptance, awareness, reducing stigma around mental health and behavioral health, not only for, I think your question came from an employer in the workforce, but also within our communities and the families of that workforce. We at Cigna, we've always seen health holistically. It's one person, mind and body connected, integrated view, whether that be coaching or clinical work or partnerships with physicians and hospitals in the community. It's all connected. And so we have to continue to see that one body approach in the same way, and how we all collectively understand that and we portray that daily is going to be so important as we move forward. But I sure hope we are at that tipping point and past it, Kathy.
Dr. Jones, do you see that? And also sort of a different person had a related question, which was what is being done with primary doctors in terms of training and teaching so that mental illness becomes part of, and you as a doctor, that you look at that as a, oncologist and a surgeon.
Our approach here, Kathy, has been number one is let's have a candid conversation on what's really going on here, because our team members, especially those who've been on the front lines, are incredibly stressed. And so whether we call it out and try to deal with it, or whether we hide our eyes and hope that it goes away, the latter one's not going to be very successful. And there are certainly in many industries, including our own, has always been a little bit of a stigma because I'm a provider. If I'm anything other than 100% perfect from a mental health standpoint, that might undermine my career success. And we think it's very important to recognize we all are human beings, and that those things are in our workforce, and especially they're going to be exacerbated as they would have been in anyone else, and to call out and address it and be intentional on addressing it. And so the good news is we got a lot of expertise within the organization to help address it. The bad news is it means that we can be discoordinated in how we address it. So I commissioned a group 6 or 8 weeks ago when we saw this really gaining steam, to come together as an organization and figure out what are the things that we can do proactively to deal with, many of which have been dealt with or mentioned here, like the EAP, videos, a number of different behavioral health interactions, from a simple coaching conversation to a direct, mental health visit. And by taking it on head on, I think we got now people willing to actually say, I need help, and it's okay to need help, way better than not getting the help we need. And so we've been intentional. As regards the conversation on primary care, it goes back to what I think I mentioned a while ago. If not, at Inova, we don't look at mental health as a separate category. It's health. And we don't look at cancer health and heart health. We look at health. And so our primary care physicians routinely, daily, deal with mental health as part of what their routine work is. And now that they are becoming more comfortable with it, I think that you'll see hopefully fewer people reach crisis where they have to go to the extremes, but to have those things diverted as part of their routine health care.
Kathy, I can comment briefly too for Adventist Healthcare. In fact, yesterday we participated in a consultation, a virtual consultation that we do about every 2 months with our primary care colleagues. So we have behavioral health professionals, psychiatrists, therapists, social workers, professional counselors, and we get cases in advance and questions in advance to discuss as a team with our primary care colleagues. And we take an hour, we provide continuing medical education, and it really has broadened the conversation and helped to increase the comfort of primary care providers who are treating many patients with mental health issues, sometimes more than the psychiatrist. So we're really excited about that initiative we've just started.
Maybe, I hope we are at a tipping point, and I hope people, employers are accepting as well. There's, of course, the standard question that every healthcare professional gets asked now, which is the future of telemedicine. I'm going to combine that, how you see the future of telemedicine, with, if you could include sort of how that works with low income and vulnerable populations that don't have maybe access to internet, and how can they receive quality mental health care. So
I mean, not to get political, but to advocate that I personally and my patients have benefited from some of the regulations that were expanded to include telephonic care, and being able to acknowledge that, bill for that, and provide that.
So telephonic means just over the telephone, not this.
Not this, over the telephone. Granted, a lot is lost. I can't see what their facial expressions, they can't see me and get that connection, but it has helped because there have been some internet connections that were not as strong, and it wasn't a lost visit. They were still able to express how they're doing, ask their questions, get their medications refilled. I think it just requires really considering everyone in our society and the level of access they have. And then, as Dr. Jones mentioned, as we reopen, we do offer in-person visits for those who don't have access to that. But I think the virtual care has helped, especially as maybe metro times and frequency has decreased, or access to transportation has decreased. Just being able to offer a wide variety of options has helped acknowledge
Dr. Jones, is this going to leapfrog us forward? Because a lot of doctors who maybe were resistant before now realize they can see more patients in a day, and I don't have to sit in the waiting room for a really long time.
Yeah, this is a classic situation of not wasting a crisis. And on my strategic plan, we had a major push towards virtual health that would have probably happened in 2023 or 24, just based on a timeline that I saw. Well, that happened in a matter of about 10 days back in March. And it's been a very good thing. And Monica may comment, because again, she's got deep experience on this. So that, I think we don't think of banking and telebanking. We think of banking, and most of it's telebanking. And so I do believe that we should reach a point where this is yet one more way that we routinely deliver health, not just in a crisis. And let's face it, for people who are nervous about being in public, there's the obvious benefit there. Dr. Leslie mentioned people being afraid of emergency departments. They shouldn't. It's our core business that preventing infection. In fact, our nurses literally in the emergency department routinely tell me they feel safer there than they do, stopping for gasoline on the way home, because infection prevention is part of it. But virtual health is one more way for people who choose to do that. The other thing that, and Dr. Leslie touched a little bit on it, is broadband access. At one point it just kind of sounded like a tagline or a political issue. We have in multiple areas, not only here right in the nation's capital, but especially in rural areas, students unable to get their health or to get their education because they don't have broadband access. It now becomes a societal issue for us to address that.
I'm going to jump in there, Kathy. I like that. Don't waste a crisis, because this virtual care is going to help us so much with access. Think about the traffic patterns, the busy schedules of individuals around here. We can seek care, have access to care through virtual means. We've seen in the last 4 months, physician groups, healthcare systems standing up virtual care for so many opportunities to engage in care, well beyond just a regular primary care visit, if you will. And we're Cigna is one of the first to roll out preventive visits through virtual means. So I really think sky's the limit here if we can all collaborate and work together collectively. Employers want this, individuals want this, community leaders want this, healthcare systems want it. Let's continue to find those right patterns focusing on access to care and quality of care.
I think I'm going to end it there because that was a really hopeful note on all three of you. And you're right, Dr. Jones. I did pick you because you all three are optimists. And unless you have, if you want a closing word on what you feel is positive looking forward, because everyone could use a little bit of hope right now, please chime in.
Well, just one thing, I'm biased because I work with youth, but I'm just really impressed with the youth and their activism and their engagement and how they've been resilient in turning, lemons into lemonade and graduating differently and connecting with each other, but also holding our society accountable for who we want to be as an American society.
I would say, Kathy, let's continue to run toward those crisis opportunities to help, not run away from them. And as we run toward them, we'll find unique opportunities to collaborate with eyes wide open. Let's do just that, form those collaborations.
Dr.
My
Jones?
comments would really address the people who are directly in healthcare in that we're right here focused on topics around a disease that didn't exist just a few months ago. And that early on, the unfamiliar was, of course, created fear. That's a natural response. And that fear has become confidence, and the ability for people, not only at Inova, but in multiple organizations across the country and probably around the world, to mobilize against an unknown enemy and develop the successes that we've seen against that in that shorter period of time tells me that really there's nothing that we can't overcome if we pull together.
Terrific. Thank you. Thank you so much to the three of you, to everyone who joined us on Zoom. We are also on Facebook Live, so I know we also have a big audience there. I'm sorry I couldn't get to everyone's questions, but I tried to get to a bunch. Thank you, the three of you, for for being on the front lines, for looking out for the mental health of so many people through your organizations. It is I hope you feel the gratitude and the love that is in the community for all the healthcare workers right now. You all have sort of double duties, as looking after them and looking after our community. We're lucky to live in Washington, D.C., and we're really lucky to have all three of you as part of our community. Thank you.
Thank you.
Thank you.